Today, Tina Mankowski and Fran Bach. Tina is a longtime UW medicine employee who began her communication work in medicine and healthcare at Harborview Medical Center, where she oversaw marketing, media relations, and communications. In 2004, she transitioned to the School of Medicine to focus on communications, primarily about research. Today, she is the Senior Director, AVP for Strategic Communications, and works for the School of Medicine, Harborview, the UW Medical Center, Northwest Hospital, Airlift Northwest, and several neighborhood clinics. Fran Kwok is the Community Outreach Coordinator at the Harborview Medical Center. Fran's primary responsibility is to represent Harborview and the Safe Kids Seattle South King in the community. Safe Kids Seattle South King. In the community, okay.
It's a coalition of organizations.
In addition to attending a variety of community events and meetings, she also oversees the Safe Kids Seattle South King Coalition, coordinates community presentations, organizes staff participation in community fundraising events, and manages Harborview's annual Children's Holiday Party. Feel free to contact Fran if you have any community outreach opportunities. So with that, I'm going to turn it over to you folks, and we're excited to hear
Is
from
that
you.
a wireless keyboard that she can?
Yeah.
Oh, excellent.
Should be.
Thank you very much for having us here today. It's always a pleasure to go out and meet new people in the greater Seattle, King County community. As I said, I'm Tina Mankowski, and I've been a longtime employee with the University of Washington. I'm going to talk about one of my favorite topics today, and that's Harborview Medical Center. And when I go out and talk to Rotaries and other service clubs, I think people wonder, well, why not Swedish? Why not Virginia Mason? Why are we talking about Harborview? And I think Harborview is a little different hospital than all of the others. Harborview is what I consider the People's Hospital. It's owned by the citizens of King County and managed by a board of trustees that you'll see in a moment, that their main job is to make sure that Harborview stays true to its mission to care for people in King County regardless of their ability to pay. Harborview is part of the UW Medicine family, and UW Medicine includes Harborview, UW Medical Center, which just recently we changed the campus at Northwest Hospital to be a second campus of UW Medical Center, so now there's two UW Medical Center campuses. There's a School of Medicine, there's Airlift Northwest, and there's a series of neighborhood clinics, as well as a huge, huge research function that the University of Washington plays in the community. So, Harborview, very mission-driven. It's, as I said, owned by the citizens, managed by the UW, governed by a board of trustees. And I think people find it very interesting to know that Harborview does not receive any operating dollars from King County, although it's owned by King County. The way in which Harborview receives any dollars towards upgrading its services or expanding its services is through bond initiatives. And if you've listened to the news lately, they're looking at perhaps going after a bond initiative later on this year in 2020. Harborview's mission statement. If anybody can read that, you've got really great eyes, but it really outlines the people that Harborview should be taking care of. And it starts with those who are non-English speaking, poor, uninsured, underinsured, victims of domestic violence, sexual assault, people incarcerated in King County jails, and it goes on and on and on, and then down to where I think Harborview is probably best known in the community is for the trauma and burn care and specialized emergency care that it provides to the citizens of not only King County, but Washington State and actually the region. These are our board members, and the board member who represents this district is Phil Dyer. Steve's Phil, second from the left over there. Again, these are appointments made by council members in King County, and the King County executive actually appoints them to this position. And their job, as I said, is to make sure that Harborview is taking care of these populations I just outlined, and that it also maintains some kind of a fiscal viability. No margin, no mission. So that's a very important balancing act for Harborview. Just a little brief history of Harborview. We actually were founded by the Sisters of Providence in 1877, and we're part of a 6-bed King County poor farm in the Georgetown area. Moved in 1906 and expanded to 225 beds. And then in 1931 moved to the place that it's currently located, which is on First Hill in Seattle. And again, as I said, today Harborview is one of the leading academic medical centers and houses several centers of emphasis in addition to the charity care work that it provides. Statistics, about 413 beds, a little over 5,000 employees, 17,000 admissions, 258,000 clinic visits, and about 58,000 emergency visits per year. Our payer mix, I think people are very, I think sometimes surprised to see that in addition to Medicaid and Medicare, which you would expect Harborview to take care of people with limited resources, we also have a percentage of commercial pay patients, and that's what really helps keep that organization going, is the commercial payers that contribute to Harborview's bottom line. I think Harborview is probably best known as a trauma center, but a lot of people aren't really aware that Harborview is adult and pediatric trauma center. So we're the only level 1 trauma center in the states of Washington, Alaska, Montana, and Idaho. So the State Department of Health has a 5-tier trauma designation for the state of Washington. And that trauma system, what it does is it ensures that no matter where you are in the state of Washington, you're going to get the care that you need when you need it. So for example, Harborview is a level 1. We have several level 2 trauma centers. Providence in Everett is a level 2 trauma center. Tacoma has two level 2 trauma centers that trade off 1 week on and 1 week off for the other area. And then other hospitals designate down to level 5 trauma centers. So we work closely with emergency medical services throughout the state of Washington. So they know if you're in a car accident in Tonasket, they know what level of trauma center you should go to. We also know that if there's a level 1 or a level 2 that can take care of you more definitively. Harborview is also the disaster control center for King County, and that would occur if there's any major disaster that would happen. Heaven forbid an earthquake, but we all keep hearing that it's coming someday soon. Harborview would set up the whole system to make sure that patients are triaged to the most appropriate facility so that not one hospital or one system is overloaded. And just another comment on the level 1 as opposed to the level 2 trauma centers. The difference between a level 1 and a level 2 is the fact that not only does Harborview provide care to these individuals, they also have teaching and research components. So a level 2 wouldn't have the teaching and research component, but Harborview, that's a big commitment that we have. Level 1s also have more what I would call subspecialties. So if you were in some kind of a horrible accident and you had like a very significant hand injury, for example, we would have physicians there who that's their only specialty. It's all they do all day long is repair hands. So you have some of those really specialized subspecialties to take care of you. Pediatric care, as I mentioned, we take care of about 800 children each year. And you can see most of them are burns and multi-trauma brain injuries. Most common injuries are falls, fall burns, motor vehicle occupant injuries, and unfortunately firearm injuries. And having a trauma system like we have in the state of Washington, really 25%. So to have a trauma facility taking care of children is really important. Children benefit from the expertise of the hundreds of adults that are treated each year at Harborview. And Harborview is considered, even though it's not a pediatric trauma hospital per se, it's considered in the top 10% for pediatric trauma nationwide. Now I'm going to see if I can do this. I'll do it. This is just a little short video that's been taken aside. I can do this for you the first time. I did it. There's no sound.
We did just.
You'll notice a sense of calm and routine. That's Dr. Eileen Bolger. She's the Chief of Trauma at Harborview Medical Center.
Eileen Bolger is probably one of the best general surgeons to work with, hands down.
But Dr. Bolger will tell you it takes a team to save lives.
Our Level 1 center is geared to deal with any life-threatening emergency 24 hours a day, 7 days a week, 365 days a year. with all of the subspecialists, all the physician specialties to care for any injury, no matter how complex it is.
It's the only one in the area, covering Washington, Alaska, Montana, and Idaho.
And we love taking care of the sickest patients in the region.
And she spends each day on the move.
This is a teenager who either fell or jumped off of a cliff. It's not really clear.
She's not only taking care of adults. Harborview's the only pediatric level 1 trauma center in the area too.
But when they are severely injured, they need the level of care and the rapid access to care that adults need. And so they benefit from that relationship.
So what we're going to do is slide a plate, which is like a picture.
Something this young boy is getting.
And it could have been worse. And I'm so very grateful.
He fell out of a window at a friend's house.
I think now he's got a broken leg, but so far that's nothing we found. So we'll get some more x-rays, but otherwise very stable. Okay.
While this is all in a day's work for Dr. Bolger, it's also why she believes Harborview is so special.
It's a mission-driven hospital. It's a safety net hospital. And I think if you talk to the people that work here, there's a sense that everybody is here with a purpose. And we love taking care of patients across all walks of life, providing the highest quality care to everyone.
From the UW Medicine newsroom in Seattle, I'm Katie Chen.
So, as a premier trauma center, there's a couple of other programs that have emanated from Harborview Medical Center, and one is Airlift Northwest. And for those of you who may have been longtime residents of this area, Dr. Michael Copas was kind of a legend. He's worked very closely with the Medic One program and really developed it into the kind of program that it is today. But he also was a founder of Airlift Northwest. And Airlift Northwest has 7 bases strategically located throughout the Pacific Northwest and Southeast Alaska. And Dr. Copas founded this for one reason. He was in Alaska at a conference, and there was a horrific house fire, and 3 or 4 children were significantly injured in that house fire. And the only burn center in the area to be able to take care of these children was at Harborview in Seattle. And he spent an entire day trying to arrange for transportation for those kids to be taken to Seattle, and he wasn't successful. The kids died before he could get anyone to be able to move these children down to Seattle. So he made it his mission to ensure that no one ever had to go through that again. And Airlift Northwest is here today. It's part of UW Medicine, but it's also, I like to call it Switzerland as well, because it works for everyone. If you need to transport someone to Swedish or transport someone to Virginia Mason, they're there and they do that. They have fixed-wing aircraft, they have helicopters, and they transport about 1,500 patients alone to Harborview each year. Medic One, which I'm sure you all should be familiar with it if you're all good Rotarians, because you helped create Medic One by doing fundraising for this program. It is now, the Medic One program is celebrating its 50th anniversary this year. It's hard to imagine it's been around that long. It was the first, and I would say probably the best program ever created. We, not me really personally, but those who work on Medic One go all over the world talking to people about how to do appropriate emergency care for patients out in the field. It started out just to take care of people with cardiac arrest, and now it's, obviously takes care of any kind of trauma that you can imagine. 2 Medic One vehicles based at Harborview, and the rest are strategically located throughout the Seattle area. We also train for King County Emergency Medical Services and for some medical services in Eastern Washington as well. So Harborview, in addition to having trauma programs and a number of the other programs that I mentioned, really does serve a vulnerable population. Over the years, like in the 1970s, when we had an influx of immigrants into the Seattle King County area, they were coming here to get their care, and we knew that we had to do something. So we have cultural mediators and interpreters, an international medicine clinic to deal with that population. We also have nurses located at the Downtown Emergency Services Shelter, Plymouth Housing, to care for those who have some behavioral health issues. The Madison Clinic, one of the first clinics in the Seattle area to take care of individuals who were suffering from HIV/AIDS. And Harborview has always provided a bulk of the mental health services to individuals throughout the Seattle King County area. I think we have 64 beds dedicated to psychiatric care. Went backwards, I just said that, didn't I? Let's see. Backwards we are. Oops. What did I do here? Yeah, this one, yes, okay. So, in addition to, you know, the trauma care that we provide, behavioral health, we have a number of centers of excellence at Harborview. And I think many people don't realize this, but we have our centers for AIDS and HIV. We probably, between Harborview and the University of Washington, have some of the leading individuals working in infectious diseases. And with the coronavirus that we're looking at right now, that's a really big deal. We have a lot of faculty members who are working on being able to identify it more accurately and also being able to treat it. We have a comprehensive rehabilitation center, Eye Institute, Neurosciences Institute, which brings together about 20 different areas of care, from neurologists to neurosurgeons to individuals who are experts in MS. And that institute covers just a wide range of different services. Regional Burn Center and Regional Vascular Center. This is not working for me. I'll just stand up here.
As you go through those, all of them are real important, but the burn center, you can imagine, is pretty important for us as electric utility. We've unfortunately had to use that about 10 years ago, and it's extremely important to get the patient to see good health immediately. So they get sent right to Harborview.
Yeah. Another one of our centers of excellence under the neurosciences is our comprehensive stroke center. We were the first stroke center to be certified by the Joint Commission. Harborview not only cares for stroke victims, they also work with hospitals throughout the state of Washington to have them send MRIs and CT scans to them, and Harborview helps them determine if they can keep that person in their community or if they have to go to a larger center for more definitive care. Another center of excellence is our Eye Institute. You can go in there and get a pair of glasses and get your eyes checked, but you can also have your macular degeneration treated, retinal diseases, ocular cancer. So it's a very comprehensive program that we have at Harborview. I'm going to let Fran talk a little bit about the community outreach that she has been doing out in the community.
So Harborview leads a coalition of nonprofits and agencies called Safe Kids Seattle South King, and basically we are a group of organizations that go out and we promote and educate families about pediatric injury prevention. So we do things, I go out to a lot of events and we have a booth and I talk to families and parents about car seat safety and water safety and window fall prevention and bike safety and things like that. And so I've been out, last summer I came out to the North Bend Block Party, and then usually in the spring there's the Snoqualmie Valley Safety Fair that's at the indoor playground at one of the community centers that I usually attend. And we also participate in bike rodeos. We're going to be partnering with the city of Renton in May and the Washington TBI Council to do a bike rodeo and helmet giveaway and a big kind of safety fair down in Renton. We partner a lot with Children's to do firearm lockbox giveaway events. And we also partner with King County EMS to do car seat inspection events throughout King County. We just had one last Friday in Shoreline. We'll have another one in North Seattle, and then we do about 5 of them a year down in Tukwila. And so I'm always looking for events and opportunities. I'll be going to the Duval Farmers Market and the Carnations Farmers Market this year, but just to go out and chat with families about injury prevention. So that's a lot of what I do. Whoops. Going back.
Another community outreach program that we are involved with is Stop the Bleed. And this is a training session. It's about a couple hours, right, Fran?
Mm-hmm.
A couple hours where faculty and staff from Harborview teach people how to be a good bystander and save somebody if there was a mass casualty incident that they would come upon, how to stop the bleed. We do these programs at Harborview. They're free courses. If anyone's interested in it, you can go to Stop the Bleed Washington and find out more. Or if your community, if you have a group of individuals that you want to bring together, like, you know, Rotarians and PTAs or whatever, they'll come out and they'll do that for the community as well. And that is Harborview in just a little small nutshell. And so if anyone has any questions, I'm happy to answer them.
I'm just fascinated by how old it is. And those Sisters of Providence started a lot of different hospitals in today, but
They did.
I've done without them.
Yeah.
In the old days.
Yeah.
Okay. I just want to know about the virus, you know, because, well, like today, they shut down Fowler, the
Waffle High School.
Yeah, I heard that on the news this morning.
How is, I know that they're working probably.
Yeah. So we are, for the last couple of weeks, I've been on a daily phone call with infectious disease experts at all our hospitals. We have a daily call and we talk about what we're doing in our hospitals, if we're, you know, prepared for it. Harborview's actually a lead in this. So, you know, they were a lead in Ebola, they're a lead in this as well. So if someone should come in, they most likely would be, you know, taken to Harborview and put into isolation. So we want to make sure that each one of our entities is prepared for this. We also on our website and on our e-care messages that go out to patients, we're letting them know that if they've traveled in the last, if you've traveled to mainland China in the last 14 days and have these symptoms, don't come in, call us and we'll talk to you. And Harborview's actually sending out a group of individuals, 2 or 3 people go out, they get their PAPRs on and they're completely covered from head to toe. We'll go in there and screen the patient and determine if they need to go to the hospital or they need to put them in quarantine at their home. They've gone out and they've done about 5 or 6 of those. We're changing our messages today because it's no longer mainland China. They want, if you've traveled in the last 14 days to Italy, Iran, mainland China, Hong Kong, South Korea, Japan, anyways, those are the like 5 or 6 different areas. And it's every day it's changing and it's, you know, moving. And there's, I think I mentioned a little bit earlier, there's a lot of grants out there that our faculty are working towards bringing in so that they can, you know, do some more work and investigation on this virus. But it's pretty, it's frightening. Yeah.
So one of the challenges in China is the capacity of diagnosis, basically being able to figure out who's sick and who's not. What's the capacity in Harborview? Like how many patients can you screen a day if they're sick or not? You know, God forbid if something comes here.
You know, I really don't know. I mean, I just know what you know. I've read in the paper that they built a hospital in 3 days or something like that. It seems pretty amazing. And you know that it was out here somewhere that was going to be one of the sites to quarantine people, and I don't think they're not going to do it at the Fire Academy anymore. But they are in Shoreline area. And then which hospital is it? One of the hospitals in Spokane actually had a grant and they built a whole wing to take care of individuals with any kind of, you know, disease like that, infectious disease. So, you know, I don't know how we're going to do it. I wish I knew.
Question, trying to compare this new coronavirus with other viruses, like the common flu, which affects millions of people every year, and several thousand die, I understand. Does this virus seem to be more contagious and or more severe than things like the regular flu, or do we even know yet?
I'm not a doctor. You know, but what I know and what I've heard is that coronaviruses the common cold is a coronavirus. And so, but it's just one of them. And this is a new one that's jumped from the animal model to the human model. So, you know, they're trying desperately to figure out a way to stop it. But coronaviruses aren't that uncommon, but this particular one is. So.
Yeah.
Assuming you can trust the statistics that are coming out of China, which some people doubt, this virus is 20 times more deadly than the common flu.
Yeah, mortality rate is like 2 to 3%, which is crazy.
The other problem that they've had thus far is identifying people who are infected with this particular virus, because it appears that some people are able to spread the virus when they exhibit no symptoms.
It is 20 times 0.1% fatality, so it's 2%.
It's about 2% deadly,
Which is significant.
which is not 98% or something like that.
But still.
But it's significant enough that it's more deadly than the flu. So it's not nothing.
If you know 300 people, that's 6 people.
But it's not, if I don't know if I'm getting this right or not, but it's also, I think the SARS and the MERS were more deadly?
Yes,
than
right.
this.
SARS was more
Yes.
deadly than this one.
Yeah, than this one is. It'll be interesting to see what happens with the person in Northern California who they say did not have any contact with anyone and just, yeah, has been diagnosed with it, so. All right, well, thank you very much. Appreciate
Thank
your
you.
time.
Thank you.
Yeah, thank you very much for that. Yeah, very interesting. Very, very interesting. Do we have anything else? Tired of talking.